Hello everyone, welcome to the arterial blood gas analysis session. I know that it's sometimes confusing even though one have a very clear conception, but sometimes in the middle of the exam it becomes very much haphazard to think of the right diagnosis. For that I have come to make a clear decision-making process easier. So let's start with that. To tell the truth, in our country, we haven't done much arterial blood gas besides in ICU setup. So it's done here on a very day-to-day basis because the ABG machine is available in the ward as well as in other departments. And all the patients need to monitor from time to time by doing the arterial blood gas. So this is the arterial blood gas machine where you can see on this portion we insert the syringe after taking the bloods and give different informations like patient's oxygen level, like if it's not on additional oxygen, he or she is on 21% oxygen. If it's like 2 liter oxygen per 1 liter, it's like 4% oxygen additional. So they need the information of the patient's age, name, date of birth, along with how much oxygen he is or she is on. And they also ask like, is it an arterial gas or a venous gas or a mixed gas? So these are the informations that needs to be given on this ABG machine first, and then we just press go and it starts to analyze. Within 2 to 3 minutes, the result comes in the screen as well as on a print copy. So this is the basic of, and I would say this is the first and foremost thing of ABG. So knowing the pH, it's 4.35 to 4.45, and carbon dioxide partial pressure is 4.7 to 6 kilopascal, and partial pressure of oxygen is 11 to 14 kilopascal. So this is a very important thing because we will decide whether it's a respiratory acidosis or alkalosis basis on this pH and partial pressure of carbon dioxide. So memorize it without any hesitation. Then bicarbonate level is 22 to 26 millimole per liter, and base excess is +2 to -2. So if it's like -2 and more less than -2, then we can say like it's acidosis and metabolic acidosis, and if it's like greater than +2, then we can say it's a metabolic alkalosis. We'll clear that, and saturation level can be from 95 to 98%. So what we need to remember, it's pH. If it's 7.35 to 7.45, it's normal. If it's less than 7.35, it's acidosis. If it's greater than 7.45, it's alkalosis. That's right. And for partial pressure of oxygen, if it's 11 to 14, it's fine. So we think like a person is on no additional oxygen. That means on air. So it's 21% oxygen. So to remember how much oxygen is normal for a person who is on 21% oxygen, that means on just breathing the normal air, just subtract 10. So 21 minus 10 is 11. So the normal level for a person who is not on any additional oxygen is 11. So just think, if the scenario says like a person is on 100% oxygen, so that means we have given the tracheal intubation, and after that we are giving the full oxygen. That means 100%. So in that case, how much partial pressure of oxygen would you expect in the ABG? Just -10. That's 100 minus 10 is 90. So just guess in a person is now on 40% oxygen. So what should be the normal level of oxygen of partial pressure for him or her? So 40%, that's 40 minus 10, that's 30. So 30 would be the expected level of partial pressure of oxygen. This is a very practical printout of an ABG from my hospital. I have just obscured all the personal details due to confidential issue. So where we can see the most important thing, the pH 7.38, which is normal. Carbon dioxide is high, and oxygen is low, and potassium is slightly low, but that's okay. And the most important thing, how can I say it's arterial? By looking at the saturation level. And venous gas would never be this much highly saturated. It's like almost 92% here. Let's go to the example now. So this 21-year-old woman, thrown from her horse at a local event, on the way to hospital, she has become increasingly drowsy, and paramedics have inserted an oropharyngeal airway and given high-flow oxygen via a face mask with a reservoir. On arrival at hospital, following rapid ABCDE assessment, an arterial blood sample is taken. So first, we have to look on where? pH. What is the pH here? 7.26. So I said earlier, if it's less than 7.35, then it's acidosis. So this is an acidosis. The second step is to look at partial pressure of carbon dioxide. So if the normal pressure of carbon dioxide, as I said earlier, how much was it? It was 4.7 to 6. Here we see how much is it? It's more than that. One thing I need to clear you all is carbon dioxide increase means increase acid, means acidosis. So it's an acidosis and carbon dioxide is increased. So this carbon dioxide is causing this acidosis. And who control the carbon dioxide? The lung. So when it's lung, it's respiratory. So who is causing this acidosis? Respiratory acidosis. That means lung acidosis. If we look at the bicarbonate level, how much is it? 26. What's the normal limit? 22 to 26. That's okay. So it's not metabolic. If we look at the base axis, that's minus 2.4. Even though that's towards slightly towards negative 2.4, but it's okay. It's 2 point something. So we can think of normal. So the diagnosis here is, yes, you're right. That's respiratory acidosis. And if we look at the carbon dioxide, how much oxygen this lady is on? 85% oxygen we are giving in addition. So how much you expect from her? Minus 10. That's 85 minus 10 is 75. So as we are giving high flow oxygen, we expect like 75 at least kilopascal of oxygen, but she is only having in arterial gas, it's 18.8. That means surely it's an hypoxemia. That's less oxygen here. So this is what? This is respiratory acidosis. Just see, the diagnosis will be acute respiratory acidosis with impaired oxygenation. Next comes another. So here we can just look on the parameters. That means which is the first step? pH. So if the pH is 7.57, that means it's an right alkalosis. So this alkalosis, we have to look then on the carbon dioxide. So the carbon dioxide is 3.4. We know how much is the normal carbon dioxide partial pressure, 4.7 to 6. So it's 3.4. That means the carbon dioxide is less. That means this is an alkalosis. So if the pH and partial pressure of carbon dioxide matches, this is exactly and without hesitation a respiratory thing. And what is this? Respiratory alkalosis. And if we look at the bicarbonate, what is the bicarbonate level? 22 to 26. So this one is within the limit, 23.1. And base excess is also normal. So what is this? This is alkalosis. What alkalosis? Respiratory alkalosis, because carbon dioxide matches with the pH. So at first we will see the pH, then try to match the carbon dioxide. If it matches with the acidosis or alkalosis, then it's a respiratory thing. But if the carbon dioxide level doesn't match with the pH, we have to next move to the bicarbonate and base excess to say it a metabolic acidosis or alkalosis. So in summary, the patient has acute respiratory alkalosis with impaired oxygenation. So as I said previously, 85% we expect it to be less than 10. That means 75 kilopascal at least, but it's less even though we are giving so high oxygen. So it's an impaired oxygenation. So the full diagnosis is with impaired oxygenation, and it's type 1 respiratory failure. Why it's type 1? Because the carbon dioxide level is not high. So what is type 2? When there is stagnation, when there is increased level of carbon dioxide, at the same time when there is hypoxemia, low oxygen level. So this is not that, so it's not type 2, it's type 1 because carbon dioxide level is not high. Next scenario also, first step, look on the pH. What is pH? 7.11. So what is it? It's an acidosis. So next comes to the partial pressure of carbon dioxide, that's 7.2. So 7.2 means it's more. So it's towards acidosis. At the same time, if we look at the bicarbonate, it's not within the normal range. So it's much less. It's decreased. As it is decreased, so if bicarbonate goes down, what goes up? The acid goes up because bicarbonate is the alkalosis part. So the pH is acidosis. The PaCO2, partial pressure of carbon dioxide, is slightly high. At the same time, the bicarbonate is much significantly low. And see the base excess, it's minus 10.6. So it's base excess means too much base, but minus means no more base. What is this? Acidosis. And this bicarbonate and base excess is in favor of the term metabolic. That means kidney controls the bicarbonate. So this is a metabolic acidosis. So this mixed respiratory and metabolic acidosis. So as I said, it was 7.2, carbon dioxide is high, and it matches with the pH. So it's also a metabolic as well as it's a respiratory acidosis. So it's a respiratory and metabolic acidosis. Both of the component is still there. Next comes if the pH is less than 7.4. Just think of 7.4 means just a mean. So it's less. Less means it's acidosis. We think of like 7.35 or less. Okay, next look on the carbon dioxide level. Carbon dioxide level is greater than 6. So it is acidosis and carbon dioxide is more. So carbon dioxide more means it is building up acid and it matches with the pH. And who makes the carbon dioxide level up and down? The lungs. So the lungs means the respiratory. So this is a respiratory acidosis. Okay, and you can see that base excess is greater than +2 and bicarbonate is also greater than 26. So yeah, I said previously, like it's the carbon dioxide matches the pH, it's a definitive respiratory thing, and it's an acidosis, so respiratory acidosis. Then why it's also another component in addition to that? This is because it is trying to compensate this rearrangement or dearrangement through making enough base. So this is a compensatory metabolic alkalosis. Next comes the pH is less than 7.4. This is acidosis, but carbon dioxide is less than 4.7. So carbon dioxide is below that. So if the carbon dioxide is below that, it doesn't support that, right? So we cannot say it a respiratory, because if you want to make something acidosis, the carbon dioxide level needs to go up, but here it's going down. So this is not a respiratory thing. And if we look at the base axis or the bicarbonate, both of them are below 22, and it's also towards the acidic part. So this acidosis is supported by the base axis and bicarbonate, and which is controlled by kidney. So this is a metabolic acidosis. And here, if it's like, so we have made the diagnosis of compensatory, the metabolic acidosis, whereas there is slight decrease in carbon dioxide, or it's towards decrease. Then why it's decreasing? If it's decreasing, that's that should be like, so it's just trying to make up. So it's like a compensatory thing. But the most important thing is we have to look like it's acidotic, but this carbon dioxide doesn't match. So it's not a respiratory thing. But the base excess meets up the criteria of 7.40 and less. That means acidosis. So it's a metabolic acidosis. Next comes another 7.40, that's greater, right? Greater means we try to make our like it's not like acidosis, it's rather alkalosis, because we have told like if it's greater than 7.45, it's alkalosis. Okay, let's see the carbon dioxide level. The carbon dioxide level is also high. So if carbon dioxide level is high, how it should be? It should be acidosis, but the pH is alkalosis. So it's not definitively something respiratory. So next, look on the base excess. On base excess, it's greater than +2 and bicarbonate is also high. It supports the alkalosis. So it's a metabolic alkalosis. Again, greater than 7.40. It means, what is that? Yes, that's right. It is alkalosis. Next, look on the carbon dioxide. Carbon dioxide is less than 4.7. Very good. So it supports the alkalosis, because if carbon dioxide is less, there is less acid, so that means alkalosis, and the pH is also alkalosis. So the carbon dioxide and pH matches. As it matches, it is obviously respiratory, and as it is greater than 7.40 means greater than 7.45, it's respiratory alkalosis. If we look at the base excess secondarily, it is also like it's going towards the less bicarbonate, that means towards the acidosis. It is trying to take it to the acidotic part. So it is just trying to compensate that extra alkalosis needs to be compensated by bicarbonate. So it's a compensatory process. So we don't need to look on that. First, making diagnosis. What is the main diagnosis? That is the first thing, which gives the pH and partial pressure of carbon dioxide. If we look on the next case, PaO2, it's a pH is 7.34. What does that mean? 7.35 is normal, so 7.34 is, yes, that's right, that is acidosis. So this acidosis, let's look on the next step, step 2, partial pressure of carbon dioxide, that is 7.3, that is increased. So it supports the pH, that is, it's also a respiratory acidosis. And if we look on the bicarbonate, oh my goodness, it's high, 30. Also the base excess is high. So this too high supports like it's an, it should be an, what is that? Alkalosis, but it is not. What is it? It's an acidosis. So it's trying to make up the bicarbonate and base excess. So it is like a chronic respiratory acidosis with a compensatory metabolic alkalosis. So when the bicarbonate and base excess doesn't matches with the pH, doesn't match, does that mean? They are trying to compensate. They are pulling towards the opposite side to make it normal. That's why it is a compensatory, yes, that's right, compensatory action, which is we call compensatory metabolic alkalosis, just to correct the respiratory acidosis. And here the carbon dioxide is also high, along with their hypoxemia, that means low level of oxygen. So it's a type 2 respiratory failure, because not only oxygen is going low, but also the carbon dioxide is high. Now comes the case 5, where we can see the pH is 7.14. What does that mean? Acidosis or alkalosis? Yes, alkalosis. No, it's acidosis, because it's less than 7.35. So this is a acidosis. Let's look on the partial pressure of carbon dioxide, that is 3.8. So what does that mean? Carbon dioxide is 3.8. Yes, so the carbon dioxide is less. So if it's less, it is not contributing acid. So it doesn't support the pH. So it's not definitively a respiratory thing. So to make it, bicarbonate is also low. So when bicarbonate is low, what is high? Acid is high. And who is responsible for bicarbonate? The kidney is responsible. So this is a metabolic acidosis. And if I ask, is the partial pressure of oxygen enough for this person on 40% oxygen? No. If it's 40%, just subtract or minus 10, which is 30. So it should be at least 30 for the person. So he is on hypoxia. So this is a metabolic acidosis. Thank you so much, everyone. So I just summarize quickly. First, look at the pH. Then look at the partial pressure of carbon dioxide. If it matches, say the word respiratory. And if it's acidosis, say acidosis. If it's alkalosis, say alkalosis. If it doesn't matches carbon dioxide partial pressure, let's go next to the bicarbonate level and base excess. If that matches with the pH level, then say metabolic. And what doesn't match, say that as a compensatory mechanism. Thank you all, and just give any feedback or if there is anything else you want to include. Thanks a lot. Goodbye.